Hello and good afternoon to you people there at South Plains Rural Health Services. My name is Ross Schamberger and I am the agent that handles your United Healthcare health insurance that you have. April 1 is the renewal date and that is coming up on us quickly, and we are staying with United Healthcare and the benefits are staying exactly, or can't talk, but exactly as they are. So the good thing for you is if you're going to leave it the same, you don't have to do anything. But the rates did change just a little bit. We had a 5% increase, which is really about half of the norm that we're seeing. 10% is pretty much a normal rate increase today, unfortunately. So we were able to come in with a 5% increase, but again, we're keeping benefits just like they are. It is open enrollment effective April 1st. So if you want to add dependents, drop dependents, add a spouse, you decline the coverage for whatever reason, and maybe you want to get on, then certainly this is the time you can do that, no questions asked. Pre-existing conditions covered immediately. So that's easy for you. You all should be getting a little packet like this that has all the materials in it. A notice that it is open enrollment, and we've noted at the bottom of that, effective April 1st, United Healthcare's noticed on your renewal that CVS is no longer an in-network pharmacy, so they will not pay for a prescription that you buy at CVS. Okay, so I know that's a change. I hope that's not a big thing. Blue Cross has done the same thing, and part of the reasoning behind that is CVS bought Aetna, and so now Aetna, who of course is a competitor to both United Healthcare and Blue Cross, owns CVS or is part of CVS. I actually think CVS bought them. So we're starting to see carriers exclude CVS from the network for whatever reason. So just so you know, effective going forward, you cannot get prescriptions filled at CVS. You'll need to get that moved over to a Walgreens, Walmart, United grocery stores, all those kind of things. When you come to Lubbock, it's the majority of the places that you get prescriptions filled, so we've not had anybody complaining about that being an issue. So I apologize for the trouble that might create for you, because you do need to get your prescriptions moved over to another pharmacy if you're currently using CVS. All right, so you can ask for Carla Lopez there at South Plains Rural Health. This is who the form needs to be turned into, and we need those in as soon as possible because it is effective April 1. So as I've already mentioned, nothing's changing, but we do have in your packet a summary of benefits and coverage. Just an annual notice. We're continuing on with the $4,000 deductible. That's what it is today, so it's remaining that way. It has a maximum out of pocket of $7,900, which is down there in the middle of the page. It tells you preventive services are covered before you meet a deductible. In other words, you can go in for a well check, preventive care check, and as long as they file that as preventive care, it doesn't cost you anything. So I encourage you, go get your well care check done. It doesn't cost as long as it is truly preventive care. When you go to see a doctor, your primary care doctor is still a $25 copay, which is good. That includes same-day lab and x-ray, which on a lot of plans has gone away. So if, let's just say you go in and they do they think you've got strep throat, and they do a strep culture, and then they come back in and they're holding a syringe and says, yeah, you tested positive, you've got strep throat, and they give you an injection in the hip. You've got the charge for your office visit, you've got the charge for that swab where they've checked for the strep throat, and then the injection. So there's three different things there. You're going to pay your $25 copay and say bye. All right. A lot of plans nowadays are you pay your $25, but that strep test and that injection are now subject to the deductible, but not on your plan. Today it's remaining the same, and you still got it that way, and that thrills me that you can continue to do it that way. If you have imaging, I'm on page 2. It's basically your plan's an 80-20 plan. Once you've met your deductible, the plan pays 80%, you pay 20%. So if you're having CAT scans, PET scans, MRIs, then you pay your 20% for those things after you've met your deductible. So that is subject to your deductible. When you go to page 3, you'll see that your prescription drug benefit is exactly still the same. So tier 1 is $15, tier 2 is $35, Tier 3 is 75. Tier 4 are going to be those really expensive drugs, and that is 250, but that did not change. We do see occasionally some drugs go from one tier to the next tier in the middle of the year as carriers update their things, but as far as your tiering goes and the deductible or the copay that goes with each tier, that has not changed. Two, a lot of plans have gone to a 6 tier, and you are still on the 4 tier, which that's to your benefit. All right. Facility fee, if you're having outpatient surgery, subject to your deductible, paid at 80%, you pay your 20%. Same way with the physicians that own an outpatient surgery. If you go to the emergency room, there is a $300 copay. That did not change. They're just trying to get people to understand, don't go to the emergency room if it's not an emergency. Okay? So I know where you're located, there may not be clinics that are open on weekends, and sometimes it's just necessary to go to an emergency room. But I know in Lubbock, we've got clinics that are open every day of the week. The hours are shortened somewhat on weekends, especially Sunday, but they're still open. So use those kind of places if you have to seek treatment. And also remember, we have Healthiest You telemedicine benefit. That's a great benefit. It doesn't cost you a dime to do it. Just to remind you, even if you don't carry your dependents on the health plan, your dependents can have the Healthiest You telemedicine with United Healthcare on the plan that you're on. It's not on all their plans, but it's on your plan. And that's a great benefit. You just call in anytime, 7 days a week, 24 hours a day, 365 days a year. You can call in and talk with with a doctor, and most of the time get a prescription called in for you at a pharmacy. There are pharmacies in Lubbock. I know it's not convenient for any of you unless you live in Lubbock, and most of you don't, that are open 7 days a week, 24 hours. We got Walgreens that are open here 24 hours a day, so you can pick up a prescription at 3 a.m. on a Saturday or Sunday morning, or any morning as far as that goes. All right, so if needed, you could do that. So, Healthiest You is a great benefit, and again, it should not cost you anything. I do advise people, go in and complete the information, because they're just like any physician, and y'all work at a clinic. They want to know a lot of things about new patients. You know, what medication do you take? What's your surgery history? Just things about you. That's why they slide that clipboard out and say, fill out all these papers. Well, Healthiest You is similar to that. They want to know what prescriptions you take. What are you allergic to? What is your health history? So you can go on and do that tonight while you're healthy. And then 6 months from now, if you do have to use it, you don't have to go through that 10-minute process of doing that. If it's 3 a.m., you're throwing up, you can't stop throwing up, and you feel like, you know, death warmed over, that is one way to do that. Go ahead and do it now, and then you don't have to do it then. And then when they do answer the phone, they'll see that you've completed that, and they'll ask you, has anything changed? And if you can say no to that, then that just moves the process on. They'll screen your call, determine if they can help you, and then it goes a lot quicker that way. With COVID, things have slowed down. In the olden days, prior to COVID, literally people would get a phone call back in anywhere from 2 to 15 minutes. Not always happening that way. It seems like it's better now, but just recently when we had another surge of COVID, it was taking 5, 6, 7 hours sometimes for people to get phone calls back. One of the ways you can maybe circumvent that is you can go online and schedule your appointment. That might help. But anyway, at times things have slowed down just because they're overwhelmed and they can't staff for the crazy things that are happening with COVID. So know that, but try to use that. We really like Healthiest You, and I hope you'll use it. And again, your dependents, eligible dependents, can use it, and it doesn't cost you anything. And they do not have to be covered on the health plan. So then as we go on down through this, if you're having again, back to the emergency room with a $300 copay. Again, they're just trying to make people think twice before you go to the ER. But certainly, if you think you're having a heart attack or something serious, go to the ER. That's where you need to be. So, emergency medical transportation, an ambulance ride, is subject to your deductible and then paid at 80%. You pay 20%. Urgent care is covered. You can go to an urgent care clinic, pay $50 copay instead of $25. But urgent care is there. Again, y'all's plan, you do not have to use a primary care doctor and get a referral to go to a specialist or to an urgent care center. So just know that nothing has changed, okay? The plan that you're on with United Healthcare does use their biggest, broadest network. It does not include an out-of-network benefit. So always make sure you're going in network. But like when you come to Lubbock, it's all the facilities. You just about can't go out of network locally. And that's what we find just about everywhere you go. So we've not had one phone call in the couple of years that we've had your plan at United Healthcare about network issues. So again, nothing has changed. Turning the page now over to page 4. If you're in the hospital, there is a subject to the deductible. You pay your 20%. Again, once your 20% hits that $7,900, then everything should go to 100%. That $7,900 does include your deductible. It includes your 20% you're paying. It includes the copays you pay at the doctor's office, the copays you're paying for prescriptions. So all of that tracks toward that $7,900 out of pocket. Alrighty, so again, in the hospital, if your doctor comes to see you, you'll have a $75 copay for them to drop by. Surgeon, then of course, certainly subject to your deductible, they pay 80%, you pay 20%. If there's mental health services needed, then there is a physician office copay of $75, outpatient services otherwise. Inpatient, again, when the doctor comes to see you, again, it's 75%. There is inpatient benefit for that. It's subject to your deductible, and paid at 80%, you pay 20%. So for people that are pregnant, ladies that are pregnant, then the primary care doctor of $25 will apply that first visit. After that, if they diagnose you as that you are pregnant, then there'll be a global fee charged for the rest of that. So all of the other visits, your delivery, your postnatal care are all under that global fee, whatever their price is that they throw out at you. So you don't pay a copay every time you go to the doctor, which is pretty frequently, and then even gets more frequently toward the end. All right. Childbirth, professional services subject to your deductible. The child will have its own deductible while it's at the hospital, so just so you'll expect that. Home health care is covered, subject to deductible and paid at 20%. There is a 30 visit limit on home health care, so hopefully you won't need more than that. But just know that is subject to your deductible. When you get into rehab, again, you've got a 30 visit maximum for physical therapy, those types of things. So all of the rehabilitation and just habilitation services are paid at 20% after you've met your deductible, with United Healthcare paying 80%. Skilled nursing is covered, just like anything else, subject to deductible, 80/20. Durable medical equipment, same way, pair of crutches, wheelchair, hospital bed, anything that needed that's durable medical equipment is subject to your deductible and paid at 80%. Hospice services are covered. If you've been diagnosed terminally ill or somebody in your family, then certainly those are covered subject to the deductible and again paid at 80%. You pay 20%. And then just a few little notes down the bottoms. Children's eye exams, glasses, dental checks are not covered. And then on the last page, page 6, actually it's not the last page. The last page is just some examples of charges. But it gives you some other things that the plan does not cover, so you might take a look at that. Cosmetic surgery, bariatric surgery, dental care, long-term care, those things. And then some other services that are covered, and where it would be acupuncture, chiropractic care, hearing aids. So they all have some limitations on them, but they are covered. If you need to know more about that, you're welcome to call us. So let me put that in right quick. You can call us anytime. Our number here in Lubbock, 806-783-8959. Ross Schamberger is my name. Ashley Allen is my assistant. We encourage you to call anytime during the year. You're maybe going to have surgery the first time. You just want to make sure you're dotting your I's and crossing your T's. Call us, let us help you. And certainly if you're having a problem and you're not happy, let us know. You don't need to be bothering Tara or the people there at where you're located. Give us a call. All right. So other than that, that is the benefit. There's only one plan to pick from. Again, if you want to add your dependents, you can do that effective 4/1, no questions asked. Again, pre-existing conditions covered immediately. So here is a flyer on Healthiest You that you might take a look at. They've got an app that you can put on your phone. I encourage you to use that. They continue to have motion. United Healthcare will pay you up to just a little over $1,000 a year if you'll get off the couch, get in motion. So this is basically just a program to try to help people be active, and that has not changed. It's still there. If you're signed up for it, great, continue. If you're not signed up for it, it's not too late. Get on it and give it a try. They've got a weight loss program called Real Appeal. And again, if you'd like to participate in that, it's a service that's provided free of charge from them. So do that. And then here are just some things about remaining healthy and having goals with Rally. So look at that if you have questions about it. Then right behind that, we've included the rates, the cost. So the employee-only cost is $498.54. South Plains Rural Health is paying that for you. You don't pay a dime. Let me tell you what, guys, most employers, I'd say 75%, are now asking their employees to pay part of their own cost. Okay, it may be a dollar amount, it may be a percentage of, but it's very common. Y'all still do not have to pay anything for your health coverage. You do pay 100% of the cost for your dependents, but nothing for yourself, and that is great. So here's an enrollment form. The plan you are on is called a level funded plan. It's only offered to very few United Healthcare groups. They look down in that group and determine how healthy you are, and then they offer you a level funded plan where the costs are actually less than it would be if it was just what we call a fully insured plan. So if you want to change anything, we need this form back from you. If you want to add dependents, if you want to enroll for the first time, this needs to be completed and submitted back. If you are not enrolling your dependents, you're a first-time employee, there's places in there to decline coverage on dependents. And then lastly, there are a bunch of forms. By law, South Plains Rural Health Services is supposed to give you certain notices. We are doing that for them. The FMLA, Family Medical Leave Act, general notice. Here is a COBRA notice. So if you were to quit, you're no longer working there and you want to stay on this plan because you're not eligible for other coverage, you can do that at full expense. You pay it for up to 18 months. For people that are disabled, it could be longer than that. And then there's just a bunch of other notices behind that they're supposed to give you. Nothing says I'm supposed to sit here and bore you stiff with it and read it to you, but you might look this over, especially if you have a hard time sleeping, insomnia or something. This is almost guaranteed to put you out. May not stay out forever, but it's so boring. But do look over that, and then feel free to call us. We're here to help you if you ever have a problem. And really, that is about it. Hope all of you stay healthy. Hope you don't have any issues this year. We do need to get these changes back in, so we will get these over to Level End tomorrow, and then hopefully maybe by a week Friday, you can have all this information turned back in. So that would be like the 11th of March, effective 4/1. That way we can get all of our changes made and go forward. So do that. If you have any questions, call us at our office. Again, the number is 806-783-8959 and ask for Ross or Ashley. Thank you very much. Y'all have a good weekend.